Actually, the world economy has just recovered from a global pandemic, but how prepared is the global pharmaceutical industry in case of another pandemic, if there's any?
Well, I think as we think about disease X and the next possible pandemic, one of the things that's really important is that we know that as a healthcare sector, we really came together during the last pandemic in order to be able to address COVID-19. And I think in this regard, it should give us a lot of confidence that we've got really a resilient and a sustainable healthcare sector. But we need to continue to focus in on those elements in order to be able to make sure that we learn lessons from the past and be ready going forward. A few things that I think are really important as we think about readiness. The first one is certainly we need to ensure that there are public-private partnerships today that are focused on the highest areas of unmet need for diseases and also areas of possible future pandemics. Secondly, I think that the more that we can focus our efforts today on system resilience by having a focus in on healthcare and investing in health more than just looking at the treatment of sickness, but in the investment of health, I think that's also going to be a really key element. And then lastly, it is also very important that we ensure that we've got regulatory frameworks in place that are nimble, that allow us to be able to meet a response to deliver medicines equitably across the globe. And I think that that's something that we did well during the last pandemic, AstraZeneca with Oxford together with our vaccine. And I think that we need to ensure that we've got the ability to be able to have that type of global equitable response. Those are the three areas that I think are most important today that we can focus in on.